So my name is Dr. John Wunderlich. I specialize in OCD and anxiety-related disorders at Psychology Specialists of Maine. My background was actually in integrated care, so I worked mostly with chronic medical conditions for the first few years of practicum and internship. And then in residency, I specialized in OCD and anxiety disorders, both at an outpatient level, but also at an intensive outpatient level. And then I worked there for a few years, both as a resident, an advanced resident, and then a few years as a primary therapist in an intensive outpatient program. Yeah, so I specialize in any of the anxiety, OCD related conditions. So OCD itself, generalized anxiety, social anxiety, panic disorder, also the body focused disorders like hair pulling and skin picking, compulsive shopping, anything that's compulsive or in that family of disorders in anxiety or OCD. So my approach typically is very CBT driven. Cognitive behavioral therapy, CBT, is the gold standard treatment for most anxiety disorders still. Acceptance and commitment therapy absolutely has been gaining a lot of ground and a lot of support in the research. And so we often integrate acceptance and commitment therapy elements, or we'll do acceptance and commitment therapy if someone has tried CBT before and it hasn't worked for them. So it's acceptance and commitment therapy is a nice backup, but most of my practice, I would start with CBT, and then we would branch out to other things if the CBT interventions weren't working. Pretty much all anxiety disorders revolve around accepting uncertainty and finding a way to accept an uncertainty. And so that would be, sort of the most common theme. What uncertainties they are, like the specific content, would vary condition by condition, but that would be the primary thing that comes up most often. What do I like most about being a therapist? That's a great question. So actually, I think one of the things that caused me to gravitate from chronic medical conditions to anxiety-based conditions is the fact that the treatments we have for anxiety disorders worked fairly well. We actually can really make a lot of ground. Not that OCD, for example, never fully goes away, and panic disorders may continue to occur throughout the lifespan, but they can become much, much better. So treatment really can work, whereas in other areas, therapy has lower rates of effectiveness. So that's part of what I love right now about my job and why I've stayed in this specialty area. you know, Individuals may have tried therapy before and it may not have worked. And there can be some real causes for that, some reasons why therapy doesn't work. And that's one of the things that I specialize in is treatment resistant conditions or situations where prior therapy hasn't worked. We can still find things that are different. And I view that as a really important part of my job. But just in terms of doing therapy in general, therapy has evolved over the decades from something with limited effectiveness to a series of interventions that really work for the majority of patients that try them and really engage in them. That's why we practice evidence-based therapy now, like cognitive behavioral therapy, and do far less of the old psychoanalytic therapy, is because it really can work. And it may take time. It may not happen immediately, but if someone sticks with it, most of the time, it can really help. Something that I take very seriously as a therapist is never pushing a patient. My job is to encourage and equip and assist you like a coach on the sidelines. I'm never going to try to push a patient to do anything. And I I think that given the nature of the work that I do, it's really important for patients to know that up front, that I'm not going to push, because the when we're doing therapy for anxiety disorders, it is really scary. It is really overwhelming. It can feel scary just to talk to a psychologist. And so I just want anyone who's considering therapy with me or with anyone else to know that our job is not to push. We'll try to create an environment and a pace of therapy that's as comfortable for you as we can make it.